Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. Talking to you from Austin, Texas tonight, where we've been raging in the 100-degree temperatures, so it's a little bit on the warm side. But it's cool in here, so that's good, as long as the electricity stays on. Anyhow, I know I haven't been that available to do these webinars over the last month and a half, and so I want to just let everyone know why. One is my mother fell and broke her hip in Fort Wayne, Indiana, so I had to go back and spend some time with her. Also, I was relocating here from Austin, Texas, and all of this has just taken time. So I am now set up to do webinars the next 4 weeks in a row, counting tonight. So we've got tonight and then 3 more weeks in a row. So you should start seeing me with some regularity here again, too. For those of you that are new here, welcome. And those of you that are returning, it's great to see you again, too. I have a number of familiar names on my message board tonight. The ways that you can participate, there's actually a couple. One is to write a question to me. And the way you do that is you use the chat box at the bottom of your screen on the right-hand side. When you write your question, the only thing I ask is that you don't hit the enter key until you're completely written the whole thing. So just write it as one long run-on paragraph, okay? Every time that you hit the enter key, it actually sends a separate question to me, which gets hard to do. The other thing I ask when you write questions is that this format works best for shorter issues, not your whole complex Lyme disease history. So just be aware if it gets too complex, I may say I can't answer it. Okay, so just be aware of that. Part of the problem with that is I don't get to do a give and take with you in this format, so I can't ask you clarifying questions to get more information that I need sometimes to make to help you with this too. Okay. The other way that you can participate is just listen to the questions as I read them. And also the responses. There's always good information that comes out of that. At least I think it's good information. I know a number of you keep coming back, so you must think so too. If you are participating in the live version tonight and not watching this in the recorded version, you will get to see the questions posted on your screen. They actually show up that way, but they do not show up on your screen in the recorded version. Okay, all right. So my intention is to spend about an hour and a half with you here tonight. If I don't overheat here, we'll see. And then, and you may, I don't know if we're going to see the Basenjis running around. I don't think my camera angle works for that. Many of you know I have a couple of Basenji dogs that come to work with me, and they are definitely here. Halo is sleeping over here on the side right now. But I don't think you're going to be able to see them moving around here tonight with the setup that I have. So why don't we go ahead and get started here? Go ahead and take the first question. Oh, one other thing before I do that. So I am creating a recording of tonight's webinar, and tomorrow morning you will get an email from me announcing that recording is ready to be viewed. I have to do some brief edits on it tonight, and then I usually write a summary of what we talked about, although I don't timestamp it because it's just me doing this and I don't have time to timestamp it, but you'll be able to see roughly where topics are within the video sequence. Okay, so watch out for that tomorrow. And when you get that email from me tomorrow morning, you'll be able to sign up for the next set of webinars, okay, the next 3. All right, so let's go ahead and get started here. All right, hi, Dave. Let's see. Hello, Dr. Ross. Can herbal mold binders, Mycopul, reduce glucose cholesterol levels and help the liver? My GP thinks it might help since my levels have improved a bit. Any thoughts? Thank you. So, Mycopul, everyone, is a binder that has various substances in it, like charcoal, clay, bentonite clay. I think it's got some silica in it as well, too. But anyhow, there's other components to it that are designed to bind fatty substances up. And specifically, they're designed to bind toxins in your intestines, okay? So some people have a problem with mold toxicity, where they cannot remove mold toxins when they breathe them in from the world around them. And those 25% of people, it's all people, 25% of people are at risk of this happening, have a problem, a genetics profile that they can't handle mold toxins. So what happens is in 75% of us is we breathe in a mold toxin, it gets into our bloodstream, and some of our immune cells will see those mold toxins and tag them. And then once they're tagged, other immune cells will come in and break down those mold toxins. That's what happens in 75% of us. 25% of us, that doesn't happen. They don't get tagged. They don't get broken down. The next step in the process is they go to the liver. The liver is supposed to remove fat-based toxins, supposed to turn them into water-soluble toxins, and then move them out into the intestines. But the liver doesn't handle these toxins well either, and they get moved from the liver out into the intestines, untransformed, and they're still fat-soluble. So when somebody has this mold toxicity issue, what we try to do is grab hold of those toxins out in the intestines, because that's the only place we can get at them, to pull them out before they get reabsorbed back into the bloodstream again. All right. So that's the purpose of using substances that bind up fatty material, like the ones that are seen in this product called Mycopul. All right. Now, cholesterol is another type of fat. So it is possible in theory that Mycopul may remove cholesterol as well too. But Mycopul does not have anything in it that should be removing sugar. So I'm not aware of how that would be involved with you having lower sugar at this point, but I could see where it might be involved with having lower cholesterol levels. And I have seen that happen in my practice as well too. Okay. All right. Thanks for that question, Dave. All right. Let's see here. Hello, Sarah. Let me get that posted here. Let's see. Hello, Dr. Ross. Over the past few years, I've been really sick with Lyme and co-infections. I have a positive ELISA here in Canada, but when I do the Elispot for Lyme, Bart, and Babesia, they all come back negative, and I'm still experiencing debilitating symptoms. Why would the test come back negative? Is it mold possibly? Also, my CD57 is only 28. Also, is neck pain a Lyme symptom or co-infection? The back of my head is also very sore and painful. Okay. Okay, so you had a positive ELISA test in Canada. All right. All right, so let's talk about testing and what it can and can't do. Okay. So when we're, the major testing that we have available, both up in Canada and here in the States, looks at whether your immune system is making antibodies. And one of those antibodies are proteins the immune system makes that attaches to a germ, and they act like a big signaling device to the immune cells to come in and grab that germ. All right. And so tests like an ELISA, for instance, is a test that measures antibodies against the Lyme infection. The trouble with ELISAs is they will miss chronic Lyme about 50% of the time. But if they do come back positive, they have a high chance of being a false positive too, because other infections like chronic virus infections sometimes can give you actually not chronic virus, other types of infections sometimes can give false positive ELISA tests. So an ELISA test is considered to be a screening antibody test, but it's not specific enough for Lyme to say that Lyme is definitely there if it comes back positive. There's a high chance of false positives on that. Okay, so I would not make a diagnosis based on an ELISA test. All right. All right. Now, when we make a diagnosis of Lyme infection, there's 4 things that we consider, and I'll talk about the co-infections here in a minute. One is, do you have symptoms that look like the illness? All right. And I would presume if you're thinking you have Lyme, you probably do. But so one thing is, do you have the symptoms that look like Lyme? Number 2, do you have any physical exam findings? And generally, other than looking really tired and having obvious cognitive dysfunction in an exam, there aren't no symptoms that specifically say Lyme. Fatigue can happen for other reasons. Brain fog can happen for other reasons. Okay, but we still look and see, do you have something on exam that might give us an indication of something of having Lyme, for instance? Okay. All right. Third thing we look at is, do you have a history of tick bites or potential tick exposures? And so tick bites would be obvious. That, might mean that you got exposed, because that's a predominant way that Lyme is transmitted. But there are people that live in regions of the world where there's lots of ticks that carry Lyme. So for instance, here in the States, in New Jersey, probably about 95% of ticks out there carry Lyme. And there's a good chance you could run into baby ticks that transmit it to you, even if you don't remember being bit. Okay. Also, hunters have a high chance. So we look at, what are your risk factors potentially being exposed to a tick that carried Lyme and getting it? And then finally, the 4th thing we consider is, do you have laboratory testing that supports having Lyme? Okay. What I would say is the ELISA is a weak test. I would not make a full determination based on ELISA. All right. And it's possible when you're making a diagnosis, remember I said there's these 4 things you've got to consider. Sometimes people don't have positive testing. One of the reasons you may not have positive testing is that your immune system is too suppressed to develop an antibody reaction or to turn on white blood cells that will fight that infection. All right. So for instance, sometimes when we treat Lyme, as we treat their Western blot or their Immunoblot or their Elispot may become positive over time. All right. So then let's talk about Elispot and other ways to test for Lyme. So what an Elispot is, it's a method of looking to see, are your white blood cells, a type of white blood cell called a T cell, activated against these infections. Okay. So there's an Elispot test to see if your T cells have recently attacked Bartonella. There's an Elispot test that looks to see have your T cells recently attacked Babesia. All right. And also looks to see we can do that with Lyme, for instance, too. Now, what we're doing is when we do this Elispot test, we take white blood cells out of your blood, put them in a test tube, and then we introduce into that test tube proteins from the germ that we're trying to see, have those white blood cells ever reacted against that germ. And then we measure, do those white blood cells make a group of cytokines? All right. So it's a reaction test. It's a T cell reaction test. Now, there's a couple things about that. So T cells will remember a germ if they've seen it in the last 2 months. And the reason it's a 2-month profile is the T cells that are circulating in you to fight infections only live for up to 2 months. All right. So so they reflect that if they come back positive, it means that sometime in the last 2 months, those germs have been in you. All right. Now, in terms of Elispot testing, it sounds great, but here's where the problem is. The Elispot testing that's currently being done by Armin labs and even a lab here in the States called Infectolab is limited because they don't test for enough strains. So when it comes to Lyme, they may be a little bit better, but when it comes to Bartonella, we recognize that there are 15 strains of Bartonella that can infect a person. And the Elispot in Armin and the Elispot here in the United States through Infectolab is only looking for 1 strain. That's it. All right. So they currently miss people that have the other 14 possible strains. Okay. Babesia, we recognize that there may be 15, maybe 20 different strains of Babesia that can infect people. The big 3 are something called Babesia microti, Babesia decani, and something called a newer strain we call Babesia oticoli. But Armin and Infectolab here in the States with their Elispot only look to see if they have antibodies against microti and against decani. That's it. Okay, so they're limited because they're not testing to see if you have reactions against enough thing. And again, if you're sick enough, your T cells may not work well enough to even be detected, or they may be so suppressed your body's not making enough to even be measured. Okay, all right. So those tests are limited for that reason. Okay, the better way to actually test for Lyme, Bartonella, and Babesia is to use a newer testing technique that IGenex has been perfecting over the last few years. And that technique is a test called an Immunoblot. And what happens with an Immunoblot is we look to see, is your immune system making antibodies that attach to certain proteins found on the covering of Lyme or Bartonella or Babesia. And when they do this Immunoblot test, basically what IGenex is doing is they're basically growing these proteins in the lab. They're genetically modified proteins that have been cleaned up to remove pieces that might wrongly attract antibodies made against other infections like viruses. So the test is good for one reason. There's a few reasons. One of the good reasons it's good is when you get antibodies stuck on these proteins that have been genetically modified and grown in the lab for Lyme, Bartonella, or Babesia, they really were made against Lyme, Bartonella, or Babesia. All right, so it takes away your chances of a false positive. All right, then with the Immunoblot that IGenex does for Lyme, they're looking to see if you have antibodies against 8 strains of the Lyme infection. All right, that ELISA test that you had done that can have a high rate of false positives is only looking to see if you have antibodies against the original East Coast United States strain of Lyme, not the 8 strains that potentially can infect people these days. Okay. For Bartonella, the IGenex Immunoblot will look to see if antibodies against 4 specific strains of Bartonella. And in addition, it will test to see if antibodies against the whole family. So in other words, if the antibody family test comes back positive, the Immunoblot comes back positive for the family, but your 4 specific strains are negative, it means you got one of the other 11, okay? And then IGenex with their Babesia is able to detect with their Immunoblot Decani and Mycopul, but they also test for the whole family. So again, within that family, if that comes back positive, it may be the Babesia oticoli, for instance, okay? So these days, my preferred method of looking at Lyme, Bartonella, and Babesia is to actually do the Immunoblot antibody testing through IGenex, because they test against more strains for both Lyme, Bartonella, and Babesia. And in addition, they're using genetically modified proteins that remove the possibility of false positive tests, okay? Now, whenever you have chronic Lyme, you may have such great immune suppression that maybe your immune system isn't even able to make antibodies, okay? So again, that point I made earlier, that sometimes as you test, your testing becomes positive, is true, okay? So my preferred way of testing these days is to do the Elispot method, not the Elispot method, but the Immunoblot method through IGenex for all those reasons that I just explained, okay? All right, let me see what else you have here. Okay, now, the other thing you said here is that you've got something called a CD57 test that's low. And I want to just make a comment about that. So everyone, CD57 is a very specific type of white blood cell that can often be low in chronic Lyme, maybe about 85% of the time it can be low in chronic Lyme. We also know that HIV can cause it to become low too. And some of us wonder if there are other viral infections that might cause it to become low too. So even though it is low 85% of the time in Lyme, and it can be suggestive of Lyme when it's low, it doesn't prove Lyme, because there may be other things that cause it to be on the low side as well too, okay? When this test was first developed years ago, probably early days when I first started managing Lyme disease back in around 2004, I think it's from back around then, we thought that we could follow the levels as we were treating somebody. And if the CD57 was low and then it started to increase, then that would be proof that we were on the right track with our treatment. But what we now know is that anytime you take a CD57 test, that level, if you run it on the same day at a different lab and you draw it right away, that level actually has a variance of about 20 to 30%. So that level you get, let's say if it's 100, and really that 100 could be 70 to 130, all right? So if you go back and then test in the future and it comes back at 130 and you think, oh my God, I'm doing great. Well, that's may still be the same number as that original one you had that was 100, okay? The other thing that further testing has shown is with the CD57 is, although we thought it would gradually go up as you're getting better, it doesn't. It zigzags this up or down about 30%, as I said. And then at the end, right as you're getting well, if it's going to go up, it shoots up all of a sudden. So it doesn't give us a useful method of tracking where you are, okay? Which then brings me to one last point. It's not part of your question, but I'm going to answer it anyhow. So I know a number of my colleagues like using Elispot testing to do repeat testing to see, does it give them some clue that they're getting somebody better? So in other words, if the Elispot test was positive and then it comes back negative, or it becomes less reactive, they take that as a sign. That means that you must be getting better from this infection, okay? So what I want to let you know is there's been no studies done saying that actually repeat testing means anything. And there's some problems with repeat testing. So as I've said, if your Lyme is really active and your germs are partying on, it could suppress your immune system so that even if you're full of germs, your immune system cannot mount a reaction, and therefore you'd have a negative Elispot test. So a negative test doesn't mean the germ is gone, okay? Also, Lyme has the ability to hide in you in ways that maybe the T cells won't see it periodically as well too. And I could say the same thing about the Immunoblot antibody testing. There really is not any testing we can do that proves when we're done treating a person or whether we're moving in the right direction with that person, okay? All right, so let me see a few other things here. So then the last thing I'd say, last part of your question, you want to know if neck pain could be a symptom of Lyme. Yeah, it actually can be a symptom of Lyme infection. It can be, okay? The other thing that I want to let you know, and again, I would consider that you haven't really adequately been tested, but you did ask, is there another condition that can look just like Lyme and the co-infections? The answer is yes, and that is mold toxicity. As I explained earlier, there's some people that breathe in those mold toxins, they get trapped in a person. There's a commonality between Lyme and co-infections and mold toxicity and even intestinal yeast overgrowth, and that is that they all trigger your white blood cells to manufacture too many chemicals called cytokines. And when cytokines are made in excess, as they often are in these conditions, too many cytokines make it so you can't think, make you hurt all over, give you fatigue, interrupt your sleep, disturb your hormonal systems. So basically all of these conditions, mold, Lyme, co-infections, too many yeast in your intestines, can look the same, pretty similar at least. And so I also like in somebody that is, that I'm questioning whether they have Lyme and I can't tell for sure, I often will go ahead and get mold toxicity testing to see if that is an issue. And the way you do that is a urine test. And the two labs I like using down here in the States, one is called Real Time, and the other one is a lab called Great Plains that just rebranded itself as Mosaic Diagnostics, I believe. Okay. All right. Thanks for that question, Sarah. Good luck to you. Hello, Frank. Let's see. Dr. Ross, in your experience with mold toxicity, is the sensation of pins and needles type pain related to demyelination of the nerves? If so, are IVs of phospholipids a faster way to treat this than taking something like ATP 360? So the symptoms of tingling and pins and needles, like you're describing, are symptoms of nerve injury. That doesn't necessarily mean demyelination. Okay. So myelin is a layer of fat that covers nerves in your brain. In the nerves that are out in your arms and your legs and even your smaller nerves don't have a protective layer of myelin on them. But the cell membranes that make up a nerve, the cell wall membranes are made up of a double layer of fat, a bilipid layer of fat. And that bilipid layer of fat, which again is the cell membrane, not another layer of fat like myelin that covers the nerves in the brain. They're two separate things, although I'm saying the word fat, but they're really two separate things. The nerve cell membranes are made up of fatty acids, phospholipid or phosphatidylcholine, phosphatidylserine are the predominant phospholipids that make up those nerve cell membranes, actually any cell membrane. And when we have chronic infections, they sometimes can get injured. And if we can repair them, that sometimes will help reverse the numbness and the tingling. This ATP 360 that you mentioned is a product made by Research Nutritionals, everyone, and it is full of these phospholipids. It's made up of phosphatidylcholine, serine, and a few other phospholipids, encapsulated in a way to get good absorption. And based on studies from Research Nutritionals, it looks like we do get improved energy because they also help repair injured membrane coverings of your cell energy factories called mitochondria, which are made up also of the same phospholipid fats. They also can get injured in chronic infection. And so ATP 360 can help with nerve membrane repair and mitochondria membrane repair. Repairing your mitochondria also helps your energy, cell energy factories work better in your cells so your body has more energy to heal, okay, and recover. Now, is IV phospholipids any better than ATP 360? To be honest, I don't know. No one's done head-to-head studies on that. I know I have a lot of success doing the ATP 360. Probably if you can afford to do the IV phospholipids, you might have a better experience because you're definitely getting good delivery of those phospholipids throughout your body through the bloodstream. But I've had good success doing that ATP 360 as well too. Okay. All right. Thanks for the question, Frank. All right, everyone. I'm going to do a quick screen share here and show you some things. All right. So let's see here. So in terms of neuropathy repair, and this ATP 360 and other steps I suggest for doing nerve repair. Take a look at this article called Peripheral Neuropathy Evaluation and Repair in Lyme Disease. And in here, I mentioned repairing the membrane of the nerve as well as the mitochondria using something like an ATP 360. I also talk about using a very strong antioxidant that can fix damage from the inside that's called glutathione. And then finally, the other thing I'm having success using is the peptide called BPC 157. Peptides are naturally occurring substances that we make. This BPC 157 is made in our stomach lining, and it's been shown to repair sports injuries, muscle tendon joint injuries, nerve injury, and help support mitochondria function as well too. So if I've got somebody that I've done my ATP 360 and I've done my glutathione and I'm not making good enough headway, I will add at least a 2-month trial to see if it's going to help something called BPC 157. And that's a product by Integrative Peptides, and it's 1 pill 2 times a day. Okay. All right. So I wanted to show you that article there. If you are looking for more information about peptides and this BPC 157 that I was just talking about, there's a whole article I have on that. It's called Key Oral Peptide Strategies to Repair and Restore in Lyme and Mold Toxicity. And in here, I describe a number of peptides, including this BPC 157. Okay. And then, there was one other thing I was going to say. Oh, I just blanked on it. Anyhow, I hope that gives you some information that you can take a look at too. Okay. Oh, I know. Earlier, I was talking about mold toxicity. So for those of you that are wanting more information about how you diagnose and how you treat mold toxicity, take a look at this article called Mold Toxin Illness. You'll find it in my detoxification section. You just hit this drop-down menu here. You come down and you click on that detoxification. It'll pull you to that page. Okay. All right. All right. So let's move on here. Thanks for your question. And good luck to you, Frank. Hello, SSR or Caesar. I'm not sure how you're saying it. But anyhow, hi, Dr. Ross. My daughter is treating BART for 3 months with doxycycline, fluconazole, and cinnamon clove oregano capsules. She had psychiatric symptoms of anxiety, rage, ADHD, depression, self-harm. Symptoms are 90% better now. I'm good. I'm glad to hear that. Before treatment, she was taking Trileptal and Prozac and is still taking them. So those are psychiatric medicines, everyone, both designed to help with some of the rage and the depression and the anxiety too, okay? 1, how was your experience tapering off the psych meds while treating BART? Do you start tapering after the symptoms are gone? 2, if she needs methylene blue, how would you do to introduce it as she is taking an SSRI? If her symptoms are gone after 4 months, but she still has a herx reaction, if she takes an herbal blend like ABART, does it mean she didn't clear the infection completely? Okay. All right. So, basically, in terms of the psychiatric medicines, I usually work with a psychiatrist on these, especially in this kind of a situation you're describing. Okay. But my general recommendations to the psychiatry is that they should treat based upon the psychiatric symptoms, and they should treat as long as the person has psychiatric symptoms. Now, if she's doing better with depression and anxiety and some of what you're describing, and those are all gone, then you could start trying to just gradually taper, but you might do a taper, so drop the dose a little bit and see how things go over a month and see if she still needs those at all or not. So I would do probably slow taper. I wouldn't do a dramatic, just stop everything at once. And even with the Prozac, you're not going to want to stop that all of a sudden, nor the Trileptal, you're not going to want to stop that all of a sudden anyhow in the normal situations. But you might want to start doing just a gradual taper and see how do her psych symptoms go. Okay, that's what I would do. That's what I would recommend to psychiatry in my practice. Okay, all right. In terms of methylene blue, So everyone, methylene blue is a drug that we're now using as an antibiotic against growing and persister Lyme and growing and persister Bartonella. All right. So for those of you who are not familiar with the words I just used, we now recognize that both Lyme and Bartonella can exist in a growing state, and that maybe about 10% of the germs, especially when you've been exposed to antibiotics, can go into a hibernating state and they stop responding to standard antibiotics. Methylene blue, which is a drug that we've repurposed, and this war against persisters, has been shown to be quite good against treating persister and growing Lyme and Bartonella in the lab. Okay, all right. One of the problems with methylene blue is that it can raise levels of something called serotonin in your brain, and which is what also Prozac does, and the SSRIs, they raise serotonin too. And so if you're taking methylene blue and you're on one of these serotonin raising drugs, you could get too much serotonin. You can get something called serotonergic syndrome. Okay, all right. What I have found in my practice is I sometimes will use those serotonin drugs together, the methylene blue and a Prozac or a Zoloft or a Celexa, but I'm usually going to want to make sure that those drugs are at lower doses. So for instance, Prozac, you can dose, I believe, all the way up to 80 milligrams a day. I might only feel comfortable using methylene blue if I've got somebody on 20 milligrams or less of a Prozac, okay? The truth is, no one's done studies to find out how much oral methylene blue can you mix with relative amounts of Zoloft or Prozac before you start getting into trouble. So it's theoretical. Most of us will do a little bit of mix and matching, but my own practice is to use those SSRI drugs, those ones that raise serotonin, at the lower end of the dosing. And it's kind of a subjective thing. Okay, it's not objective, it's subjective. But I will periodically have people do both, but I don't want to use my antidepressant medicines at full dosing if I'm going to do that. Okay, all right. And then let's see here. So the only way I would do it with her Prozac is, in my practice, and you're going to talk with your own doctors about that, is if she were on Prozac of about 20 milligrams a day or less. That's how, in my practice, I might do that. Okay. If her symptoms are gone after 4 months, but she still has a herx reaction, if she takes an herbal blend like Abart, does it mean she didn't clear the infection? Maybe, but it could be that the Abart is killing some other germs too. So the Abart has a number of agents in it that, although we use it in some cases for Bartonella, herbal antibiotics have broad range of things they kill. And so just because you get a herx on an herbal antibiotic does not, and you're using it against a certain germ, doesn't prove you have that germ, because they have broad killing abilities. Many of these herbs kill a lot of different things. Okay. All right. And then let me see if I got all of your questions here. Yeah, I think I answered that. Good luck, and I hope your daughter continues to improve. Hello, Sarah. Hi, Dr. Ross. What would be the reason for my period to cause such a flare-up in symptoms? Every month I get extremely ill right before and on my period. I get increased brain fog, nausea, dizziness, stomach upset, fatigue, and body aches with chills. All right, so there's a couple reasons that could be happening, Sarah. So in men and women, and then I'm going to come to the related to the period part of this too, but in men and women, there are some people that will have a cycling of their symptoms about every 3 to 4 weeks when they have a Lyme infection. That does not seem to happen with Bartonella. That does not seem to happen with Babesia, but it does seem to happen with the Lyme infection. We think it has something to do with the growth cycle, the germ, that you get more growth about every 3 to 4 weeks. Therefore, there's more germs that are seen by the immune system. The immune system reacts and you feel a lot worse. Okay. All right. Now, the other thing, though, that happens in women is your immune system can fluctuate in its functionality based on where your hormone levels are. And so for some women, the dropped estrogen levels you get going into your period and the hormonal changes going in your period may trigger some decline in the immune function, leading to more symptoms too. What I have done in my practice before, if I had somebody that had really horrific changes every time around their period, I might actually start using birth control pills continuously to try to prevent them from having a period. I've done that before, but again, that's something you should talk with your doctor about to see if that would be something that would be okay for you to do, okay? But sometimes I'll do that, just use birth control pills continuously to stop the periods from happening while you continue to work on the Lyme infection, okay? All right, good luck to you, Sarah. Hello, Nick, let's see. I have a history of Babesia, Bartonella, and Borrelia with a major relapse 16 months ago, which consisted of extreme dizziness, weakness, and tremors. Quintuple helped this relapse out with the tremors and weakness, but the dizziness has persisted for 16 months. Have you ever dealt with extended dizziness and what has helped with it? Also, any recommendations for extreme joint pain? Thanks. So I don't often think of, so there's a type of dizziness that can occur in Babesia, which is more of an imbalance. And to kind of describe that, people that have this imbalance due to Babesia often feel more comfortable walking along a wall to help support them from kind of tipping over, okay? Versus true dizziness or vertigo is more of a spinning merry-go-round type of feeling. Or some people have a type of dizziness, more of a cloudiness and brain foggy type symptom, okay? That cloudiness, brain foggy type symptom or this vertigo type of spinning sometimes can be neurologic in nature due to either Lyme infection or Bartonella. And the Quintuple that you were on, I doubt that you just told me everything you're on, but Quintuple is just an agent against Babesia. So if you're still having a lot of that kind of dizziness you're describing, I would wonder about Bartonella or Lyme still being active, but I would need to ask you a lot more questions about your symptoms to be able to say that's for sure. Okay, so I'm raising a question. I say, I wonder, but I can't tell you for sure whether it's Bartonella or Lyme that are active, but they could be, okay? Ongoing joint pain can also be from Bartonella, and joint pain can also be from Lyme. So I would need to ask you a lot more questions to try to help clarify what this is exactly and to give you good direction, which I can't do in this kind of a setting, unfortunately. Okay. All right. Good luck to you, Nick. Hello, Paula. Let's see. How can I protect the endothelial cells? Japanese knotweed is high oxalates for me. So your endothelial cells are going to be affected by Bartonella primarily. And to protect them, you got to remove the insult. So if it is Bartonella and you can't tolerate Japanese knotweed because of oxalates, then you could look at other ways of treating for Bartonella. And that could be using cryptolapis as an agent that could do that. Japanese knotweed, Akuta, both can do that. Cinnamon clove oregano capsules can do that. So I would just look at other means of doing that, okay? Some people also wonder if arginine would help protect those cells. I haven't had much experience using that to tell you for sure, okay? All right, good luck to you, Paula. Hello, Megan. Hi, Marty. Can you get burning hot, sometimes itchy feet from nerve irritation from yeast without an associated rash or any obvious skin irritation in athlete's foot? Burning is worse in hot water, better on ice. Seems to get worse with wet feet in the warm socks. Seems to get some improvements on antifungals. Burning feet started when I had a major systemic yeast problem. Or does this seem more of a neurologic symptom due to Lyme and Bartonella? So Megan, let me just give you some thoughts. I don't know if I'm going to be able to answer it without being able to ask you some questions. So when you have too many yeast in your intestines, so not on your skin, but in your intestines, those yeast will trigger the immune system that lines the intestinal tract to manufacture cytokines, okay? And so those cytokines can lead to inflammation as they get in the bloodstream, will irritate other areas of the body, including your nerves, removed from the intestines. In addition, I wonder, and I haven't seen any good science on this, but we know that yeast overgrowth in the intestines releases toxins, okay? And I think that those toxins are neurotoxic in some people. So if you have too many yeast in your intestines and those toxins from the intestines get into your bloodstream, they could irritate the nerves, and that can give you worsened neuropathy when you're on them too. So to see if yeast is still there, I would want to know if you have any symptoms that suggest too many yeast, okay? So neuropathy itself does not necessarily mean too many yeast, okay? So too many yeast, you would think of, are there any increased sugar cravings? Is there any intestinal gassiness or bloating? Did you get worse when you added sugar into your diet? Do you still get worse when you add sugar into your diet? Are there any skin rashes? And what the skin rash relationship is not that you have yeast on your skin, but rather whenever you have too many yeast in your intestines, the toxins they release will go to your skin and interact with the skin, and their interaction can lead to increased pimples, acne, sometimes eczematous type rashes as well too. Okay, all right. But also, if you don't have enough symptoms suggesting yeast, I would be wondering about Lyme or Bartonella, or injury from having had those infections as well too. Okay, all right. Good luck to you, Megan. Hello, Sarah. Is dizziness and off balance a symptom of Lyme or co-infection? I think I just discussed that a little bit earlier. All right. So I hope you heard my response when I talked about dizziness earlier. Okay. Hello, Kelly. Let's see here. Hi, Dr. Ross. I saw you on the last week of your practice. I remember. Sorry that you're having to come here still, unfortunately. Let's see what we can do to help you, though, okay? For the past 4 months, I have been on clarithromycin 500 milligrams 2 times a day and 150 milligrams of fluconazole for Bart and Lyme. I've seen good improvement until the past month. Anxiety is back, pain behind the eyes, spine pain, numbness on and off in the feet. We talked about methylene blue. I read this could be added to my current treatment. What are your general thoughts on this? My MD will support blood tests, also cinnamon clove oregano, baluchi, BPC 157, turmeric, ashwagandha. Thanks for your input. I think all those other things are what you're currently taking. So although you're on, so there's 2 things I would think about here, okay, Kelly. So first of all, as I mentioned earlier tonight, and I know you know from working with me too, whenever something gets worse, all of a sudden you got to wonder about too many yeast. Now, I know this seems kind of strange because here you are on fluconazole as part of your Bartonella treatment, and I'm saying you might have gotten too many yeast, but it is possible. So yeast are increasingly learning resistance to fluconazole. And so even though you're using fluconazole in this treatment, which everyone, we think of, you tend to think of fluconazole as diflucan, you think of it as a yeast treatment. But based upon Johns Hopkins research from a few years ago now, we now know that azoles, the family that fluconazole is in, the azoles have the ability to kill growing and persisting Bartonella. All right. So I, about over a year ago, I started adding fluconazole into my treatments and found good benefit for Bartonella. And I think that's what Kelly's describing here, is that she started having some good improvements on a regimen built on fluconazole. But I have seen people get yeast while on fluconazole. All right. So the first thing I would look at, Kelly, is just see, if I were asking you questions in a visit, I would want to know increased sugar cravings, are you having any gassiness and bloating, any vaginal itching, discharge, any worsened skin rashes, any problem with pimples or acne, and if you have sugar, do you feel worse for it? Okay. And if you answered a number of those as yes, I might change the fluconazole to itraconazole. Itraconazole is in the same family as fluconazole, but it's a good replacement for when fluconazole or your yeast start learning resistance to fluconazole. The dosing I like to use for itraconazole, for yeast, and to treat Bartonella. So if fluconazole treats Bartonella, itraconazole will too. I like to dose it as a 100 milligram pill, and that's 2 pills 1 time a day. Okay, all right. Now, let's say you looked at this and you discovered, you think, no, I don't have too many yeast. You just said no to every question I just answered there, or a lot of them you said no to. Then I think you could go ahead and add methylene blue to this. And I have done treatments before that are clarithromycin, fluconazole, and methylene blue. It's okay to use all of those together. The way that you would, so that's one option. Okay, now I'm also going to raise another issue with you. I'll talk to you about how to do methylene blue here in a minute. Rarely fluconazole and the azoles can give neuropathy, unfortunately. So let me just see here. Oh, okay. No, it isn't just, so it's not neuropathy. It's the anxiety, back pain, spine pain, and the numbness. So the numbness got a little bit worse, but in concert with all those other symptoms that look like Bartonella that got worse, I don't think it's the fluconazole causing the numbness. Okay, so I just want to clarify that. Okay, all right. So you could, if you don't have too many yeast here and you don't make a change to itraconazole, you could add methylene blue to the fluconazole and clarithromycin that you're taking. You would need to have it compounded and in, that may be difficult now. The pharmacy that I was using to do that in Canada was a pharmacy called Cripps Pharmacy near Vancouver. The trouble is Cripps lost its prescriber and evidently they're no longer sending things cross country either, even when they get a prescriber back due to some issues with Ozempic out there as well too. So I'm not sure where you would get it, although you could come into the States and pick it up. So the 2 pharmacies here in the States that are compounding it, one is a pharmacy in Cedar Park, Texas, outside of Austin. And the other one is a company called InfuServe down in St. Petersburg, Florida. Both their products are good. It's you would want to do 50 milligrams 2 times a day is how I have people start that, okay? Before you start methylene blue, though, if we didn't do it, and I can't remember off the top of my head, or no one else did it before, you need to get a blood test done for something called G6PD, also known as glucose 6-phosphate dehydrogenase. If you have, this is an enzyme found in your red blood cells. If you have low levels of G6PD, it could, and you take methylene blue, it may lead to hemolysis or breakage of your red blood cells. All right, so you want to get that checked out, and that's something your primary care doctor up there could do. It's a common test. They should be able to do that for you. Okay, all right. I hope that gives you some things to work with there, and good luck to you. Hello, Heather. Let's see. Hi, Dr. Ross. Thank you for doing these. You're welcome. I recently saw a new LLMD who said that Lyme is in my nervous system. See, switching my main antibiotic from doxy to minocycline because it gets through the blood-brain barrier better. I haven't switched yet because I'm mentally very sensitive to medications. Do you think this is a good switch? And do you find that your anxious and depressed patients tolerate it okay? I also have Bartonella. I've been taking Houtenea, Cryptolapis, and purchased BLT by Research Nutritionals. Do you think that these, along with minocycline, would be effective for neuro-Lyme and BART? The answer is, yeah, I think it could be. Okay. And then let me comment about doxycycline and minocycline. So minocycline is more fat soluble than doxycycline. Our brains have something that protects them from injury called the blood-brain barrier. Okay. And essentially what it is, it's a fatty layer that keeps things from the bloodstream from getting into the brain. And so in theory, if you have something that's more fat soluble, it may get in there better. But doxycycline has good brain penetration, even though it's not as fat soluble. So I have used Minnow when I think I need to get more brain penetration, but over the last year or two, I've seen more studies that would suggest doxy is pretty good at doing it too. Okay, all right. The other thing you should be aware, so minocycline, because it's so fat soluble, in a very small percentage of people, like 5% or less, can concentrate so much around in the fatty layers around your nerves, in the myelin sheath around your nerves, for instance, that it can irritate those nerves sometimes. So about 5% of people get some dizziness on it. And I have seen a rare person that gets more depressed or anxious on it too. Now, I said rare, okay, but to disclose it to you, yeah, I mean, there is a concern. That doesn't mean you don't give it a try, but be aware of it, okay? The other thing I want to let you know, because it's fat soluble, things that are fat soluble do not get out of your system right away when you stop them, okay? So I forgot to bring back my my drug device, but there's a phenomenon in medicine called a half-life, the amount of time it takes to get half of a drug out of you, okay? And actually, we're going to look it up together. I'm going to give you an idea how long it would take minocycline to get out of you if you try it and you stop it and it gives you trouble, okay? So let's do a screen share. We'll do it together. Okay, so half-life of minocycline. So the half-life of minocycline, here it is. The biologic half-life is about 14 to 22 hours or 11 to 26 hours. So let's just say it's 4 hours. It's at 24 hours for the sake of this discussion, okay? So it's going to take 4 half-lives or 4 days for minocycline to completely get out of you. I've seen it sometimes take up to a week when people have trouble, all right? All right, let's go back here. All right. Talk it over with your doctor, though, okay? I mean, I think it's a small chance you would have worsening, but to answer your question thoroughly, that's what you asked. And so I just want to make you aware of that, okay? All right. Good luck to you, Heather. Hello, Doug. Hi, Dr. Ross. I tested positive for Bartonella on the IGenex fish test. Clearly, the test shows I currently have Bartonella, but does it also indicate that Bartonella is causing my symptoms, or is that always a clinical diagnosis? Thank you for all you do. All right, so whenever we test for something, anything, calcium levels in the blood, sodium levels in the blood, whatever infection we test for, there is always the possibility of getting a false positive. There always is. Doesn't even matter if it's a fish test. Fish tests also have some false positives. Okay, so what a fish test is, everyone, that fish, FISH, stands for fluorescent in situ hybridization. That's a mouthful. What that means is we take something that fluoresces, an agent that fluoresces it, and we attach it to the genetic material of the germ. And so in situ means we put this marker on the germ where it is. Hybridization means that we stick it on there. Okay, so basically, it's fancy words to say we take a fluorescing agent and we attach it to the germ. All right, so that makes it so we can see these germs better. And so you would think if something is fluorescing, then it must be the germ. But there still is the possibility of false positives there. Small, but still a possibility. So in anything that we test for, the possibility of a false positive increases dramatically if you have no symptoms of the illness, okay? So you might want to consider, do you have symptoms that could be Bartonella? And so the big ones that you usually think of are cognitive decline, sometimes pain on the soles of the feet, lots of neuropsych issues, sometimes depression, anxiety, ongoing anxiety can be part of that. Some fatigue, joint pain can sometimes be part of it. Various types of neuropathies, including seizures or seizure-like activity. Those would be things that make me think of Bartonella. Air hunger sometimes can be one of the symptoms of Bartonella as well, too. Okay? All right. Thanks for the question, Doug. Good luck. Hello, Laura. Let's see here. Hello, Dr. Ross. I have a functional medicine doctor who believes I have Lyme. I have never had half the symptoms, never had the bullseye rash. I was reacted to only 2 bands, 41 and 58 on the IgG, 41 IgM. The symptoms began last October. I took a semaglutide shot October 1st and was feeling anxiety, heart palpitations, tremors, shaking, buzzing feeling in the body, insomnia, food intolerance, and after 3 weeks, I felt better. I got COVID end of October and was feeling okay, and about a week, went back to the gym, started having anxiety again, and it hasn't gone away. Now I am having brain fog, nighttime is worse, joints hurt, tingling, numb, hollow feeling, wonky hormone feelings. I'm struggling. I don't know how I'm still here. I started doxycycline for 3 weeks, and now my doctor wants to put me on cryptolepis and phytocidal. I feel so bad. My stomach is full and feels as if it's not digesting. I'm scared. Some think I have BLL, not Lyme. I'm not sure what, unless you mean Bartonella. Listen, this gets really complicated. And it's complicated in a few reasons. Number one, it's complicated. What's happening to you is complicated, okay? Number two, to really help figure this out with you, I would need to ask you a bunch of questions. And obviously I can't do that in this setting. But I'm going to give you some things to think about, okay? So in terms of having had COVID, that's your wild card here. People get post-COVID symptoms even if they didn't do too bad in the initial COVID. I have seen that happen, or a month or even 2 months down the road, they start developing symptoms that are probably related to that COVID that they had. All right, so I just throw that out for you. I understand these symptoms that your doctor wonders, he's wondering if it's Lyme because of the symptoms, but what I want to say is post-COVID sometimes can lead to situations like this as well too. All right. In terms of the testing that you had done, in that 41, so these 41 KDs that you have here, the 55 KD, these are the weights of certain proteins that we find on the covering of the Lyme germ. The IgG is a type of antibody your immune system will develop after it's had an infection in it for a while. And to call an IgG positive, you need to have at least 2 of the following proteins, okay? Antibodies against 2 of the following proteins. That is 31, 34, 39, 41, and 83-93. So you need antibodies against at least 2 of those. You don't have that pattern. So what I would say is you don't actually have solid testing that says Lyme. And that 41 is subject to having a lot of false positive readings as well too. On the IgM, you would need to have at least, to be sure it's positive, you would need at least 2 of those same ones again. Okay, so again, the 6 are, actually, I didn't list them all for the first time. The 6 for IgG and IgM are the same. There's 23-25, 31, 34, 39, 41, and 83-93. Those are the 6. And to say something is positive, you want antibodies being picked up against at least 2 of those 6, okay? All right, now, your stronger way of testing for Lyme and maybe Bartonella from what you've described here, because Bartonella can give anxiety too. I would, if you were my patient, at a minimum, I'd probably go back and retest the Lyme, and I would retest for Bartonella using the IGenex methodology that I mentioned earlier tonight. The Immunoblot testing through Bartonella can find Lyme if it's present based upon sensitivity testing about 95% of the time. And their Immunoblot method has rare false positives, as I mentioned earlier tonight, okay? Bartonella, there's data would suggest a sensitivity of around maybe 90%, meaning you can find if it's there about 90% of the time. But, and again, because of their testing technique that they use, the method that they use, where they use genetically modified proteins to remove false positives, again, that test, if it comes back positive, is real too, all right? if I were working with you, just from what you've written here, and again, I don't get to do the give and take questions here, but from what you wrote, I'm wondering post-COVID, okay, your doctor is wondering, could it be a Lyme or a co-infection or a tick-borne infection like Bartonella that could have gotten reactivated from having COVID? I can't tell for sure. As a starting place to even wonder if this is a tick-borne infection, I would do the Immunoblot method through IGenex for IgM and IgG for both the Immunoblot on Bartonella and on Lyme. That's what I would consider doing with you. Okay. All right. Good luck to you. If you missed the whole discussion I had about testing for Bartonella, Babesia, and Lyme, I think it was one of the first questions I took tonight. So take a look at that in the recording tomorrow too. Okay. All right. Hello, Lou. Let's see. If herbals kill pathogens like Lyme, don't they hit the gut microbiome just like antibiotics? Store-bought probiotics can't replace all that is lost. Lou, you raised some good points. So if we look at using prescription antibiotics versus herbal antibiotics, the risk of causing injury to the gut microbiome is much greater with prescription antibiotics, okay? Now, I believe Dr. Buhner as in Buhner Herbs, has written a lot of books about herbal antibiotics for Lyme, the tick-borne infections, was thought to have said that he didn't consider the gut had risk for using these herbal antibiotics. I disagree. I've had a number of patients in my practice that developed intestinal yeast overgrowth while on herbal antibiotics. So it can happen, meaning you get disruption of the good bacteria in your gut leading to overgrowth of the yeast that are there. Okay, so it can happen. But I got to tell you, it doesn't happen to the same degree that it happens with prescription antibiotics. So it's all relative. All of them do stand for some potential of interrupting the good gut microbiome, but prescription's much greater chance than the herbal antibiotics do, okay? And what you're doing with your probiotics while you're on herbal or prescription antibiotics is you're treading water. You're putting enough in that hopefully they keep up with what you're killing. But you're really not going to be able to rebuild that gut microbiome until after you're off of these agents, okay? All right. Thanks for that question, Lou. Hello, Donna. Hold on here just a minute. All right. So thank you. You're welcome. Last summer, a raccoon bit me. Oh, boy. I'm sorry to hear that, but that was painful. ER visit in September, tick bite with a 5-inch EM rash. Took 10 days of doxy, negative Lyme test. By December, I started having foot neuropathy, ankle rashes. By March, solo foot pain so bad I was unable to walk. Back to the ER, 28 days of doxy. Second negative Lyme test, no mention of BART or rickettsia. By April, severe foot sole pain, tooth pain, shocks, shin, pain, tremors, sore throat, stretch marks on knee. Saw LMD on May 1st, 2022, and sent tests. Third negative Lyme test, positive rickettsia. Still waiting on BART Galaxy. MD won't treat without results except a BART not taking. Shouldn't doctor have treated me immediately? P.S. Own cats, ran dog rescue for years. One of my dogs has Lyme. Live in Maryland. So I'm going to answer that. Hold on just a minute here. I want to read back through here again. So September, I got bit by, so summer, raccoon. ER visit, September, tick bite, 10 days of doxy. Back to the ER. Okay, so the second time you went back, you got 28 days of doxy. All right, so Doxy does do a good job if given long enough at taking care of rickettsia. I just want you to know that, okay? And I would think at this point, having had 28 days of Doxy, I am doubtful you have a chronic rickettsia infection, even though that came back positive, all right? I know your Lyme testing is coming back negative, but depends on how the test was done and what technique was used. If you're really wanting to explore if Lyme is there, the best way to test for Bartonella or Lyme these days is actually the Immunoblot through IGenex. I mentioned that earlier tonight, okay? But it's still possible to have Lyme and have negative testing. That happens about maybe 10, 20% of the time, all right? In terms of Bartonella, I know he sent it off to Galaxy, and I can understand, but let's talk about the Galaxy method versus the Immunoblot from IGenex, all right? So Galaxy is doing a technique where they're looking to see, do you have the DNA material of Bartonella in you? And that's called a PCR test. And they do a type of technique called an enhanced PCR test where they try to feed the germs to increase their growth so there's a better chance of seeing them, okay? So one of the troubles with doing blood testing, measuring the DNA of a germ, is you have to have the germ swimming by the needle when you draw the blood. And Bartonella, although some of it lives in the blood, a lot of it lives inside of cells. And so the Galaxy method is good on the one hand, and that if it comes back positive, you really have Bartonella, okay? Meaning it's very specific for Bartonella. But on the other hand, we don't know how sensitive it is because the testing has never been done by Galaxy to say how good is their test at finding the needle in the haystack that rarely swims by the needle when you have the blood drawn, okay? All right. And they'll even tell you they haven't done sensitivity tests to know how good is their test at finding it when it's there. The one positive thing, again, is that when it is come back positive, it really is real. The other positive is that their PCR technique does look to see if you have any of the 15 potential strains that can infect you. Okay, so that's good. These days, though, I think that as a screening test, the Immunoblot through IGenex is better because what it's doing is it's measuring your antibody reaction that can detect, and it's able to detect, have you made antibodies against the whole family of Bartonella that includes those 15 strains, okay? And antibodies are in you all the time. They're swimming around. We don't have to worry about a germ randomly going by the needle. Antibodies are easier to detect when they're there and a germ is in you than the DNA of that germ is, all right? So anyhow, if it comes back negative, I would consider going back and repeating your Immunoblots. I know they're expensive, but these days that tends to be your better test going for both Bartonella and Lyme, okay? All right. And the other thing about the Immunoblot for Bartonella and Lyme, for Lyme, the reason Immunoblot's better is they're looking to see if they have antibodies against 8 strains. Out on the East Coast where you are, we're starting to see a lot more of a couple of European strains that have worked their way across the water. And some of the standard Western blots that are being done don't pick those up at all, okay? So I'll just throw that out for you to consider, okay? All right. Now, your question, and this comes down to who the doctor is. In my practice, I would have done presumptive treatment with you. You've got enough stuff here saying probable Bartonella, maybe Lyme. I would have covered for you while we're starting to treat. That's what I would have done. Now, that doesn't mean every doctor does. And you have to keep in mind, all of us risk our licenses when we treat you because our medical boards are crazy, okay? So your doctor may have had scrutiny from his board or be concerned about the board and what it would say if he treated you without a positive test. And he may be erring on the side of just trying to keep his practice going so that he can help other people as well too, okay? We all have our different degrees of risk that we're willing to take in this. I mean, I've been, pursued by my medical board before, and it's not a fun thing to go through. And so all of us have different standards about what we're willing to do, okay? All right, so I can't necessarily say he's wrong. It may be that there's some reasons that your doctor decided to operate that way. If you were in my practice from what you wrote down here, I would probably have started presumptive treatment with you, okay? All right, good luck to you. Hi, Criselda. Let's see. Hi, Dr. Ross. I gave Lyme. I would like to know your thoughts on neuroplasticity or brain retraining. Is out of my comfort zone. Your opinion would be very helpful. Thanks for your webinars. They are helping lots of us with Lyme. So, you're welcome, by the way. So neuroplasticity, everyone, is an idea, or not even an idea. It's a phenomenon that happens where an injured brain can repair itself. And specifically through this concept of neuroplasticity, neurons in your brain that have lost connectivity to other neurons in the brain can actually heal and reconnect and start working again. Okay, so there's some things that can help with that neuroplasticity. One is hyperbaric oxygen treatments that's been shown to help repair nerve injury in the brain, and in some people can be helpful. Another type of treatment that can be helpful that helps with neuroplasticity is doing brain games, and I think that's what you're talking about here. So those can be helpful. Doing things that challenge your brain to think and learn new patterns is good. There are also sometimes physical therapy and occupational therapy can get you to start doing things that your nerves won't do. They'll keep working with you to push and retrain the nervous system to start working correctly. That's neuroplasticity as well too. So I think neuroplasticity is a good concept, and there are things you can do working with it to repair the brain. Okay. All right. Good luck to you. Hello, Mark. Let's see here. Hello, Dr. Ross. Our friend Laura is looking for some answers, and we all know that you are the best. Thank you. Here is her journey in her words. I have a functional medicine doctor who believes I have Lyme. I have never had to have this. Oh, I think we answered. Laura left a question earlier. Yeah. I already answered that question earlier. Thanks for helping your friend Laura. Hello, Kate. Best way to support autoimmunity and modulate immune system. I have 2 AI other than LDN. Thank you. So low-dose naltrexone is is an agent you can use to regulate the immune system. That's the LDN that you mentioned there. And I understand you're looking for other ideas. Okay. All right. So other ways that you could modulate the immune system, one of those would be to do some peptide therapies. So let's talk about peptides real quick. I think I mentioned them earlier tonight, but let's look at it again. Okay. So peptides are made up of amino acids. That's the building blocks. Okay. And as you know, proteins are made up of amino acids as well too. All right. So what's the difference between a peptide and a protein? Well, the amount of amino acids. So if you have 40 or less amino acids, we call that a peptide. If you have more than 40 amino acids, we call that a protein. Our body produces a number of natural peptides. And in fact, I think about 100 different peptides have been classified at this time. There is one of those peptides that we would call the Swiss Army knife of peptides. And that's a product called BPC 157. BPC 157 can do tissue repair, muscles, tendons, and nerves. Okay. It also can help your mitochondria work better, and it can balance Th1 and what is known as Th2 inflammation. All right. So that's something to consider that you could do. I usually start a person on one pill twice a day and see where they go with that. Okay. All right. The other way that you can balance that Th1, Th2 would be to use something called TB4 frag, which is another peptide. And that also would be one pill 2 times a day. And that's something to consider doing as well too. Okay. All right. Now, probably though, the other way that I would look at doing for the TB4 frag. So the LDN, one of the things that the LDN does ultimately is it results in increased function and amount of a type of cell called a T regulatory cell. All right. Think of a T regulatory cell as the parent. All right. The other two types of major families of inflammation are something called Th1 and Th2. All right. Th1 is inflammation in the cells related to attacking an infection. So these would be your T cells, your germ fighters, macrophages, things that fight germs. That's Th1. Th2 is made up of your cells that make antibodies, is made up of your mast cells, and is made up of other autoimmune type cells. All right. These two need to be in balance. If they get out of balance, if you get too much Th2, for instance, it suppresses Th1 and you can't fight infections as well. All right. The thing that keeps balance between these two is your T regulatory cells. All right. LDN can help raise the T regulatory cells. The BPC 157 I was just telling you about and the TB4 frag can help create some balance in the cytokines that are released between Th1 and Th2, but it doesn't do anything for the T regulatory cells. All right. There is another peptide that is no longer available here in the States. It was injectable called thymosin A, and thymosin A could upregulate your T regs like the LDN does. Integrative Peptides, the company called Integrative Peptides has come up with another formulation. They call it thymosin A1, which is made up of a couple different peptides that are intended to mimic the effect of the thymosin A, okay? And they, in theory, should be able to elevate your T regs and get better T regulatory function. So that's another option for you to look at as well, too, okay? Now, I'm going to show you an article that you can take a look at here. So if you're trying to do something that's more directly related to LDN's effect, I'd probably go the Thymogen Alpha 1 is what they're calling that product. If you're trying to just regulate Th1, Th2 inflammation, I would go BPC 157 or the TB4 frag or a combination of both of those, okay? All right, so let's see here. Okay, so in terms of those peptides I was just mentioning, take a look here under integrated peptides. This is a company that makes oral peptides. This is the BPC 157 I've mentioned a couple times tonight. The TB4 frag you can find either as a spray or it's available in a pill form as a product called TB4 frag Max now. And then this is the Thymogen Alpha 1 I was telling you about that's meant to mimic the effect of thymosin, the thymosin alpha that I was telling you about, okay? All right, then in terms of the article where you can learn how to use these, take a look at the peptides article I have. This is it, and it's called Key Oral Peptide Strategies to Repair and Restore in Lyme and Mold Toxicity. In here, I describe the BPC 157. I talk about the thymosin active 4 fragment. I talk about thymosin alpha 1, okay? And then down here, I describe that this thymosin alpha 1 is not available, but it's being mimicked by this oral product called the Thymogen Alpha 1. And I describe that here for you, okay? All right. All right. Good luck to you. Hello, Kristen. Hello. As with many others, I'm taking a ridiculous amount of supplements. I know that I'm supposed to take cat's claw, endographis, otobobark, cryptolepis, knotweed, houttenia, and psittacuta. Can I take these together? I know I shouldn't take them with other things, glutathione, vitamin D, but can the others be taken together? There are so many tincture supplements that it's almost impossible to take them all with the 1 to 2 hour time window with no food, etc. All right. So in my practice, right, now your doctor may have a different feeling, but my practice, I would have you, first of all, I would probably try to clean this up. I'm not sure if you need to be on all those herbal antibiotics at the same time. All right. I'll just say that. I don't know exactly what you're trying to treat. You didn't tell me. This looks like this could be a Lyme Bartonella protocol, and you might want to streamline it by possibly just doing cryptolepis, Japanese knotweed, maybe the cat's claw. Those could be enough just to get you well. Okay, I'll just throw that out. Okay, but again, talk to your doctor and figure out what their rationale is. Endographis has got some recent data from Johns Hopkins University experiments that says it doesn't do anything for Lyme. I know Buhner recommended endographis and others recommend it, but they're basing their recommendation on the fact that endographis can treat another type of spirochete called leptospirosis. But the evidence when we use it against Lyme says it doesn't probably do anything, to be honest with you. Okay, so you might consider cutting back on some of those. Can they be all taken together though? Yeah, you can take them all together. I have people take them all together at the same time, put them in the same glass of water, drink them. For the best absorption, it is better to take them on an empty stomach. However, when I've got people taking very, very complex regimens, I'll have them take it with their other supplements at the same time, because sometimes getting it in is better than not getting it in at all. All right. So those are my thoughts. You should talk to your own doctor about that though. Okay. All right. Good luck to you. Hello, Cheryl. Let's see. Hi, I'm a former patient. I live in northern Idaho. No Lyme literate physicians anyway close. Seattle is closest. Need help. So Cheryl, I'm not treating anymore. I'm actually in Austin, Texas now. I just retired from my clinical practice, and I'm focused now on doing Lyme education efforts for people living with Lyme, but also for physicians coming up too. And the two big things that I'm trying to produce down here is a social community for people living with Lyme. That's something good that's called Lyme United that I hope to introduce later this month. I'm still building out the website and the functionality on it right now. And then later this year, I'm wanting to set up a network of physicians that need help treating Lyme to start supporting people that are new to this so we can grow a whole new pool of providers. So unfortunately, I'm not there to help you. You may want to take a look up in northern Montana, up in, I think, Whitefish, which might be close enough for you. Hold on here, just I have to. I think there's a naturopath up there named Julie Barter. She is in, Whitefish. How do you like that? I remember that correctly. So up in Whitefish, Montana is Julie Barter, and which would be somewhat closer to you than going all the way over to Seattle. Alternatively, if you decide to go all the way over to Seattle, my practice partner up there is a physician named Dr. Kim Iller. She's a naturopathic doctor. She does prescribe. She does herbal treatments. She's an option for you to consider as well too. Okay. All right. Good luck to you. Hello, Renee. Let's see. Hi, Dr. Ross. Renee here. I think I know which Renee this is just by the way you said that. Since you know me, okay, I know which Renee this is. Well, I won't go into the history. However, the extreme bloating and weight gain is back. I was only able to go on a 9-day prescription of fluconazole because Portugal pharmacies won't fill more than that. I also finally received my additional supplements. Let's see. PPC 157, Cerebro Prep, Candistatin, ATB 360. I'm also back on nystatin 2 pills 2 times a day. Hoping to schedule a call with you very soon. Let me know if you think the yeast is back. Thank you so much. Yeah, Renee, we should have a visit. I'm not sure we're going to work out with the physicians not being able to prescribe long-term for you in Portugal, but we can talk about it. And yes, this does sound like yeast is back again. So I will try to reach out to you separate from here, just try to set up a time where we can talk so we can give some direction to your physician there. Okay? All right. Take care. Hello, Shauna. Let's see. Hi, Dr. Marty Ross. Thank you for these webinars. You're welcome. I'm on a protocol now with my doctor. I'm on double dapsone, doxycycline, rifampin, hydroxychloroquine, and methylene blue with supplements and biofilm busters. Is this protocol strong enough for major neurological Lyme disease? That's been going on for 5 years now. I have not had major herx reactions. Does this mean I need to change up the protocol? I've been on this protocol since the beginning of May. So I would say, the dapsone protocol that you're on here is a strong protocol. That doesn't mean it's going to work on everyone. The data that we had, so this protocol is a protocol that was developed by a physician named Dr. Richard Horowitz. And initially he did a low dose, which is 100 trying to work people up to 100 milligrams a day of dapsone. Then he came up with this 200 milligram protocol. Now he's come up with a 400 milligram protocol. All right. I worked with the protocol in my practice before. When Horowitz first came out with this, he did some research that he published that showed that people on this protocol, there was about 40% of people had to stop it because they couldn't tolerate the side effects of it. Okay. Actually about 45%, that is. And of those that were on it, most of them had already been on other Lyme treatments, and this is what they were going to try as an alternative. And of the people that did get better, which were in the 55% of the people that were on it did get improvements, the improvement ranges only ranged 10 to 20%. All right. And when he published his data on his high dose, which is the 200 milligram protocol you're on now, he did not include any data about how many people had to drop out because they couldn't tolerate it. So we really don't know how effective it is for all comers. I will let you know I've done the various protocols, and my experience is not as good as what he publishes. It is a regimen that can help some. Because you're not herxing, though, doesn't mean it's not working. So a herx reaction is a reaction when your immune system sees dead bug parts, it will react and make more of those inflammation cytokines. And cytokines are the main, are what give you most of your Lyme symptoms. They're made because the white blood cells make too many of them when you have Lyme. And if the immune system sees more dead bug parts and makes more cytokines, you're going to feel worse. That's a herx reaction. But in my experience, about 5 to 10% of people go through treatment and never develop a herx. So lack of having a herx doesn't mean it's not working, okay? And then let me give you some other data to consider. And these are things you should talk to your doctor about too. When it comes to the Lyme germ, not Bartonella, not Babesia, but the Lyme germ, there's been some studies done that were not published looking at how quickly people turn around, all right? And one of these was a study, I believe, done by Stricker out in San Francisco. It wasn't published. In his office, he put everyone on 2 antibiotics, one called clarithromycin and the other one called Flagyl, to treat just the Lyme germ alone. And what he found is that by 3 months, 30% of people started having improvement. That means by 3 months, 70% of people were having no improvements, okay? All right. By 6 months, 60% of people started having improvements. And by 9 months, 90% of people started having improvements. All right. So with the Lyme infection, sometimes it's just a matter of hanging in there and continuing to try. Okay. Now, if you have Bartonella and it's a treatment that's working, and this treatment would cover Bartonella as well too, usually on an effective treatment, by 2 months in, you should start seeing some improvements in symptoms related to Bartonella. And if you're not, then it's time to think about a change. All right. That's how I work in my practice. So, and again, I can't tell from what you've said here whether it's Bartonella or Lyme. You wrote neuro-Lyme, but if you have severe neurologic Lyme, sometimes that means Bartonella is part of it too. So I can't tell. I would need to ask you a lot more questions. But if this is Lyme, yeah, this treatment may work, but it just may take more time. If this is Bartonella's part of it, it's not working, and I would consider a change. Okay. All right. Good luck to you. Hello, Sally. Dr. Marty, what do you know about Rife machines in the treatment of tick-borne infections? All right. So Rife machines are machines that generate electromagnetic frequency. And the idea with using these electromagnetic frequency machines is that these electric waves can resonate with the covering of the germ and burst it or kill it. Okay. Much like if you were to take a singer and put them in front of a glass of water, like an opera singer, and they would sing in a way that breaks that glass. So in theory, it could work. All right. And I have had some people that have gotten better on it. My observation in my practice is that about 40% of people that try rifing get some improvements. All right. About 40% to varying degrees. I've never seen anyone get cured with it. Okay. Now, keep in mind that any drug that we have in the physician's desk reference or that has been approved, if we do what are called double-blind randomized controlled studies, where we give, during the study, we give some people the real drug and we give some people a sugar pill, 30 to 40% of the people in the sugar pill group will get better too. That's called a placebo effect. All right. So the fact that about 40% of people in my practice feel better rifing, is that placebo or is it a real effect? I don't know. Okay. The other thing, there's a group called LymeDisease.org in California that has a data collection project going on now called My Lyme Data, where I think there's about 17 or 18,000 people enrolled now that answer a questionnaire to get in. And then periodically, My Lyme Data will contact certain people that they want based upon their initial answers and ask them follow-up questions. Their project a few years ago was looking at what alternative medicine treatments do, and are they effective, and do people have side effects? Okay. And so they published their findings, and I think they found that for people doing rifing, about 35 or 40% reported some improvements. I'm going to look at that with you right now, but I think that's what it came down to in their study. Okay. So hold on here a minute. All right. So there's an article I've written based on their studies, which is called What Works? Navigating Prescription and Alternative Medicine Lyme Treatments. All right. And I'm just going to scroll down here. One of their studies they did asked people what got you better, and overwhelmingly it was being on prescription antibiotics. That's what this first half of this article is about. This second part here is about their alternative medicine study. Okay. And in their alternative medicine study, Rife machines, about 35% of people reported moderate or effectiveness of doing Rife machines. Okay. That's kind of comparable to the 40% I was telling you about. But again, keep in mind that we see that placebo effect of anything we give a person is going to be in the 30 to 40% range as well too. Okay. All right. All right, Sally, thanks for that question. Oops. Oh, gosh, we've gotten late here, guys. I need to move on. I've had a good time being with you here tonight. I actually missed doing these the last few weeks when I was traveling across the Midwest. I look forward to seeing you again next week. I'll be here 3 more weeks in a row. And take a look at your email tomorrow morning. You'll get an email from me announcing that the recording is ready, that summary is ready. And in that email, you'll also be able to sign up for next week's webinar as well, too. Good luck, everyone. I look forward to seeing you next week. Bye-bye.